Good evening, everyone. On the day of DVT awareness, I'll give a small message to the audience regarding DVT, how it is managed, and what are the precautions to be taken on anticoagulants. First of all, what is DVT? Deep venous thrombosis, or DVT, is a condition where a blood clot forms in the deep veins, usually in the legs, causing leg pain, warmth, redness, or swelling. But sometimes it can be silent too. DVT is not just a leg problem. It can become life-threatening if the clot moves up to the lungs. Early diagnosis and treatment prevents complications and reduces long-term damage to the veins. Prompt treatment also lowers the risk of clot returning back in the future. How is DVT managed? The treatment of DVT includes giving blood thinners. There are two types of blood thinners classically. One is the older medication like warfarin or acetram, which is effective but requires frequent blood testing and dietary precautions. We have newer oral anticoagulants like rivaroxaban, apixaban, which are easier to use and have fixed doses, do not require monitoring, and have very few food interactions, making them more convenient to most of the patients. How long should you take the blood thinners? Minimum of 3 to 6 months. Sometimes, in some people who have recurrent clots, clotting tendencies, or the DVT occurs unprovoked without any risk factor, we may give treatment for a longer duration, sometimes even lifelong. So the duration is decided by the individual risk factors. Let us discuss about the precautions to be taken on the newer oral anticoagulants. So when you take these newer oral anticoagulants, you should not skip a dose. They have a short half-life, so you should take the medicine at the same time every day. Do not skip doses because missing even one dose can increase the risk of another clot. Watch for signs of bleeding like unusual bleeding, black stools, blood in the urine, or prolonged bleeding like menorrhagia. Inform the doctor before any surgery or even dental procedures. Avoid painkillers which can make the blood thin and can lead to issues. You should always inform your doctor or hematologist if you're pregnant or have kidney or develop liver problems. Any doctor you consult, you should inform them that you're on blood thinners. Avoid activities that can increase the risk of injury, and never stop the medication without medical advice. These are few of the precautions you need to take when you're taking blood thinners in general. Sometimes women have excessive bleeding during periods when they are on blood thinners. If the bleeding is excessive, please consult your gynecologist. Medicines like tranexamic acid may be given under supervision and be taken under supervision. Do not self-medicate. Do not stop blood thinner during periods without medical advice. Finally, DVT is a serious but treatable condition. With timely diagnosis, proper medication, and regular follow-up, most patients can lead a completely normal and active life. Stay aware, take your medicines regularly, and seek medical help if you notice any warning signs. Thank you.